Welcome. I am Terry Tropin, and today I'm talking about medical and surgical related procedures. This video covers sections with the initial digits 2 through 9. Presentation includes general information about the root operations and compares similar ones in different sections to help tell the difference. Many coding classes focus mainly on the surgical codes, and there's little information on these other important areas. First, let me introduce myself. I have a master's in healthcare administration, informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an HEMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I also have written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-PCS coding, ICD-10-CM coding, and external clauses. These are available on Amazon. These are the sections of ICD-10-PCS that will be discussed in this video: placement, administration, measurement and monitoring, extracorporeal assistance and performance, extracorporeal therapies, osteopathic, other procedures, and chiropractic. You will note that the characters in the tables are different in many cases than the ones used for surgery. They are also different among themselves. For example, the character titles for the placement section are different than the ones used for extracorporeal therapies sections. However, the approach values are the same ones that are used for the surgical codes and are defined the same. We will start with placement procedures, which have an initial digit of 2. The other digits are body system, operations, body regions, approach, device, and qualifiers. Some of the root operations for placement are the same as for the surgical codes, but some are not. For example, change and removal are also used in the surgical section. The definitions are the same. Other root operations are included in the placement section that you won't see in surgery: change, compression, dressing, immobilization, packing, and traction. Note that the only possible approach is X, external, and the only possible qualifier is Z, no qualifier. So placement procedures do not require an incision or puncture. Devices other than casts are off the shelf, meaning ready-made. They do not require extensive design fabrication for the fitting. For example, mechanical traction apparatus, wound packing, brace fitting, splint. So these are all can be stored in a closet and taken off the shelf for a particular patient without any extensive adjustments. Here are the root operations used in the placement sections and their definitions. So if you look at Appendix B in your PCS book, which is root operation definitions, you will see definitions of root operations for surgery, but also for these sections. So we have change, taking out or off a device from a body region and putting back an identical or similar one. Compression, putting pressure on a body part. Dressing, putting material on a body region for protection, such as a dressing for head wound. Immobilization, which is a way of limiting or preventing motion of a body region, such as placement of a splint. Packing, putting material in a body region or orifice. Removal, taking off a device. And traction, exerting a pulling force on a body region in a distal area, such as in fractures. Immobilization, it is tricky because if it's provided in a rehabilitation setting, you're not going to use this code. You're going to be using a code from Section F, physical rehabilitation, not a code from placement. So let's do a practice. If you want to find the code on your own, pause the video. Sterile dressing placement to left groin region. The answer is 2W2ZX4Z. In the index, find dressing inguinal region left, which refers you to this code. So the good thing about many of the codes in this category is you have the whole code in the index. Now, it's still important to look back at the table to make sure that everything applies in a specific case, but it is helpful to have all of the codes in, all of the digits in the index. The next section I'm going to talk about is administration, which begins with a 3. Note that there are only 3 possible choices for the body system: circulatory, indwelling device, and physiological systems anatomic. There's a variety of body systems and regions, various characters describing veins and arteries, body cavities, specific body parts, are products of conception. There are 6 different approach values. The substance can be a drug. The substance being administered can be a drug, it can be a blood product, it can be stem cells, or it can be pancreatic islet cells. The qualifier sometimes, often, is no qualifier, but you also have a description of the kind of blood cells or pancreatic islet cells from the patient, not from the patient, or might also be a specific substance in the case of a drug. You might also want to take a look at Appendix I, the substance key, substance definition in your PCS book, where you can look up a specific drug and it tells you which substance value to use. Administration procedures involve putting in or on a substance that is therapeutic for treatment, prophylactic for prevention, protective, diagnostic, nutritional, or physiological. The route operations are infusion, injection, or transfusion. And here's a definition of these route operations with some examples. Introduction, putting in a substance, maybe therapeutic, diagnostic, nutritional, physiological, or prophylactic. Introduction is not used for blood or blood products. Those are some of the other, that's for transfusion. The body part value indicates the location the substance is being introduced, not the location where the substance will have an effect. And this, an example is nerve blocks. Irrigation is putting in or on a cleansing substance or dialysis substance. Transfusion is putting in blood or blood products. Blood product or stem cell is the substance. For example, transfusion of cell saver red cells into a central nervous venous line. So this administration procedures are used for procedures for transplantation of bone marrow, stem cells, and pancreatic islet cells. These are coded as administration, not transplantation. These are also, a physician will often document transplantation of these substances. You're not using transplantation in the surgical section, you're using administration. The guidelines state you use the body system value, such as the vein or artery, for the area where the substance is being given, not where it's going to take effect. I said that in the previous slide, but here's an example. So insulin can be administered into a peripheral vein, but where it's going to take effect is, of course, the pancreas. But you use the site for the vein where it's administered, not for pancreas where it's going to take effect. There are 2 body system region values which may need some more explanation. These are products of conception used with route operations, transfusion, and introduction. Now you remember from the surgical section, from the section on pregnancy, that products of conception refer to, excuse me, all structures created due to a pregnancy. In other words, the woman didn't have these structures before she was pregnant. So these include fetus, amniotic fluid, amniotic membrane, amniotic fluid, placenta, umbilical cord. So these were formed because of the pregnancy. So the body system region characters 7 and E in the administration section refer to products of conception. Transfusion of blood or other cells into tissue is 3027 and then additional digits. An introduction to therapeutic substance 3E0E. Blood or a drug may be infused into the amniotic sac or other tissues to treat a condition in the unborn baby. So let's do another practice. If you want to give yourself some time to answer it on your own, pause the video. Peritoneal dialysis via indwelling catheter. In the index, find dialysis peritoneal, which refers you to 3E1M397. Again, you have the whole code in the index. It's interesting that this is coded as an irrigation, which is defined as putting in or on a cleansing substance. So that's not what you might think that it would be, but that's how it's coded in PCS. So let's compare administration, placement, and transplantation. Transplantation is used in the surgical section. It is used for moving a living body part taken from another individual, not the patient, or animal. And the tissue involved is described as autologous or non-autologous, from the patient or not. Administration is introducing a substance into the body. It could be blood, it could be drugs, it could be cells, as we talked about, bone marrow, stem cells. Placement, on the other hand, is taking out or off a device, such as traction, splinting, or packing material. So these three different root operations can be confusing, and just keep in your mind, if it's tissue and it's living body part, it's transplantation. If it's cells or drugs introduced into the body, it's administration. If it's a device, it's placement. The next section is measurement and monitoring with the first digit 4. There are only two body system values, physiological system and physiological devices. The root operation is either measurement or monitoring, so only two possibilities here. Measurement, root operation 0, is defined as determining the level of a physiological or physical function at a point in time. It's a single measurement. Monitoring, on the other hand, is determining the level of physiological or physical function repeatedly over a period of time. So you're monitoring it over time. So this is a series of measurements. So it's single, it's measurement. If it's a series of measurements, it's monitoring. The body system values for this section are numerous. However, one may cause confusion, and that's products of conception. There are two different values this time. Products of conception cardiac and products of conception nervous. So products of conception cardiac, which is value H, is for electrical activity, rate, rhythm, and sound. So it's the fetus's heart. Products of conception nervous is character J, and this is for conductivity, electrical activity, and pressure. So let's do another practice. Pause the video if you wish. Cardiac stress test, single measurement. In the index, find measurement, cardiac, total activity stress, which refers you 4A02XM4. So this is you'll find this under measurement. Next, we'll talk about extracorporeal assistance and performance. Codes from this section begin with a 5. Extracorporeal, of course, means outside the body, so therefore no incisions are being made. The body system for all these codes is physiological systems. Here are the root operations. So you have assistance, performance, and restoration. Assistance is taking over a portion of a physiological function by extracorporeal means, and supports functions but does not completely take over them. Performance completely takes over the function, also extracorporeal. And restoration is returning or attempting to return a function to its original site. So assistance is support, performance is completely taking over, restoration is trying to go back to the function as it was. And here's some examples of those. You can also see that in Appendix B in your PCS book. So for root operations, assistance, and performance, the function values are output, oxygenation, filtration, ventilation, and pacing. For root operation restoration, you have one function value, and that's rhythm. Also, you have a duration value for extracorporeal assistance and performance. For assistance and performance, the duration values are intermittent, continuous, and then by hours, less than 24, 24 to 96, or greater than 96. For the root operation restoration, you have duration values single. But that's it. Qualifier values for this section are for assistance and performance root operation, you have a type of a pump, you have a type of a membrane being treated, airway pressure, hyperbolic supersaturation, high nasal flow velocity are no qualifier. For root operation restoration, there are no qualifier values at all. Here's another practice question. Again, pause if you want. Intermittent mechanical ventilation for 16 hours. In the index, find performance respiratory less than 24 consecutive hours ventilation, which refers you to 5A1935Z. Again, it gives you the whole code in the index. A related section is extracorporeal therapy. This section begins with a 6. Note that the 6th and 7th values are both named qualifier. The body system is always physiological systems. The duration is either single or multiple. So here are the root operations for extracorporeal or systemic therapies. I had to get a drink of coffee. Oh, that's better. So you have a number of root operations to choose from in this: atmospheric control, decompression, electromagnetic therapy, hyperthermia, hypothermia, pheresis, phototherapy, ultrasound therapy, ultraviolet therapy, shockwave therapy, and perfusion. And here are all some definitions and examples. I find the examples to be very, very helpful. Duration values are either single or multiple. Perfusion root operation includes only a value for single. In most cases, remember we said that the qualifier value is used for sixth character and seventh character. In most cases, the sixth character qualifier is no qualifier. The exception is perfusion. For this root operation, the qualifier is donor organ. Perfusion refers to the passage of fluid through the body system. So passage of fluid through a donor organ. In most cases, the seventh character qualifier is no qualifier. The exceptions for this are pheresis and ultrasound therapy. So the qualifier in these cases might be blood products or blood areas or body areas. For root operation pheresis, the qualifier is blood products such as platelets, plasma, or stem cells. For root operation ultrasound therapy, the qualifier is a body area such as heart or blood vessels. So extracorporeal assistance or therapy. So does it go in the, do you use the value 5 or 6? Is it extracorporeal systematic therapy or is it assistance? So extracorporeal assistance in performance, equipment is used outside the body to assist or perform specific body function. So it's assisting a body function. Extracorporeal therapy is to treat a system. It's not taking over a function, it's treating a condition. Also notice that for section 5, the duration is intermittent, continuous, or by number of hours. In extracorporeal therapy, the duration is just listed as single or multiple. Here's another practice. Pause if you wish. Whole body hypotherapy, single treatment. In the index by hypothermia, whole body, which refers you to 6A4Z. This is one of the cases where they're not giving you the whole code in the index. In the table, you see the duration value is single, 0. The qualifier characters 6 and 7 are Z. So you have 6A4Z, 0ZZ. Be careful with hypothermia and hyperthermia. When you're trying to code these and you're in a hurry, it's very easy to choose hyper when you're really looking for hypo. So the next section is osteopathic, which begin with a first character 7. The body system is always anatomical regions. The root operation is always treatment. The approach is always external, and the qualifier is always none. So the only ones you have to really worry about are 4 and 6. Here are the method values, character 6. So you have articular raising, facial release, general immobilization, high velocity, low amplitude, indirect, low velocity, high amplitude, lymphatic pump, muscular energy, and other methods. So here's a practice: indirect osteopathic treatment of the sacrum. In the index, find osteopathic treatment sacrum, which is issued as 7W04X. In the table, you see the method value is indirect, the qualifier value is none, so the total code is 7W04X4Z. A related section is chiropractic procedures, beginning with first digit 9. Like osteopathic procedures, the body system is always anatomical regions. The approach is always external, and the qualifier is always none. The root operation is different. This is manipulation. Manipulation is the manual, meaning using hands, involved in a directed thrust to move a joint past the physiological range of motion without exceeding the anatomical limit. So moving a joint without breaking it, without exceeding the anatomical limit. So here are the methods used for chiropractic. These are also different than osteopathy. So you have non-manual, indirect visceral, extra-articular, direct visceral, long lever specific contact, short lever specific contact, long and short, mechanical assisted, and other. And again, if you look at the Appendix B, you'll see definitions of these with examples. So when is the procedure chiropractic and when is it osteopathic? It depends on who's providing the service, a chiropractor or an osteopath. Also, you'll have different root operations. A chiropractic is manipulation, osteopathic is treatment. But it really depends mostly on who's doing it. So here's the practice. Chiropractic extra-articular treatment of the hip region. So the guideline B4.6 says the hip is coded to lower extremities. In the index, find chiropractic manipulation, extremities lowers, which refer you to 9WB6X. That's only 5 digits, so you have to go to the table. The method value is D, extracurricular. The qualifier is Z. So the total code is 9WB6XDX, DZ rather. So I did these out of order because I wanted to do chiropractic and osteopathic together. So let's go back to section 8, other procedures. These codes begin with an 8. The body system value is either indwelling device or physiological systems, anatomic regions. The root operation, always other procedures, and the other values there are vary. So what are other procedures? Well, this is kind of not elsewhere classified, kind of equivalent to that. Other procedures include methodologies which attempt to remediate or cure a disorder or disease. So it's easier to understand what this is if you look at examples. Acupuncture, massage, in vitro fertilization, robotic assisted procedures, and computer assisted procedures. Some method values, characteristics in these codes in this section are used with surgical codes. Most of the other ones are fairly straightforward. I mean, you know what acupuncture is. But for computer-assisted procedure, robotic-assisted procedures, near-infrared spectroscopy, fluorescent guidance procedures, you might list a surgical code and then these codes to give more information about what happened. So it's sort of like add-on codes. Codes in this section have guidelines for imaging procedures, fluoroscopy, computerized tomography, and magnetic resonant imaging. These are in some qualifier values for other procedures. Now, to assist the main procedure, use a code from this section with the code for the main procedure. If the imaging is the primary procedure, that's why the patient was there, use code from the imaging section. So is it to assist or is it the main focus? That's the question. So here's another final practice. Robotic assisted laparoscopic total resection of the uterus, just the uterus in this case. So for the surgery, you're going to go into the index and find resection uterus, which gives you 0UT9, and refer to the table, and this gives you the surgical code 0UT94ZZ. But you also do a code for the robotic assisted part. So see robot-assisted trunk region 8EW4CZ. So you're going to report both codes. There is no way we can remember all the guidelines and the definitions in the PCS book. Here are some suggestions of things to write in your book to help you find these codes more easily. I think ventilation is kind of confusing. You have to go through a number of entries. So just write in ventilation, right? Write in ventilation, see performance, or write in the first couple of digits of the table. That way you don't have to go through so many steps. That's in the index. In the table, make a note somewhere between the difference between transplantation, administration, and placement. That, for example, bone marrow is not a bone marrow transplantation is not done in transplantation, it's done as administration. So you might make a note in your book about that. In the other procedures section, make a note of the codes, the root operations that can be used in addition to a surgery code, used with a surgery code. You might also make a note of the difference between chiropractic and osteopathic codes, and also the difference between extracorporeal assistance and performance and extracorporeal therapies. That completes this video. If you have questions or comments, please feel free to contact me. Again, here are the books I've written on coding. They're available on Amazon. The easiest way to find them is this, or you can just go into Amazon Books and type in my last name, Tropin. Thank you so much for listening. I hope to have more lessons up soon. Thank you.